Good afternoon, everyone. Myself, Dr. Radhika. Today I am going to speak about prevalence of dry eye disease among medical students in a tertiary care center. There are no financial interests. Dry eye disease is a multifactorial disease of the tears and ocular surface that result in a symptoms of discomfort, visual disturbance and tear film instability with potential damage to the ocular surface. It is accompanied by the increased osmolarity of the tear film and inflammation of the ocular surface. The overall prevalence of dry eye disease ranges from 5 to 50% depending upon the criteria, age, sex and population studied. It is usually more common in Asian populations than in Caucasian populations, and prevalence rate increases with age. Although numerous studies have been conducted to investigate the nature of dry eye disease, only few studies have been attempted regarding the characteristic of dry eye disease in healthcare professionals. Aim is to estimate the prevalence of dry eye disease among medical students in a tertiary care center. Objectives is to study and analyze the dry eye parameters in medical students and to assess the association of dry eye with average screen time in medical students. My study type is cross-sectional study. Duration is of 3 months. Sample size is 100 students. Sampling method is consecutive sampling. Study population is medical students of Ashram. Study area is Department of Ophthalmology, Ashram, Eluru and Andhra Pradesh. Inclusion criteria is medical students who are willing to participate are included. Exclusion criteria is students having glaucoma, strabismus, severe trauma, contact lens wearers, undergone refractive surgery for vision correction, other ocular eyelid surgeries that may affect the ocular surface health. Approval was obtained from the Institutional Ethics Committee. Written informed consent is taken. The study have been conducted by using questionnaire with 2 sections. Demographic data with pre-existing medical condition and average daily screen time, and a dry eye questionnaire using the ocular surface disease index. All students underwent routine ophthalmological examination along with shimmer test and tear film break time as a screening tool for detecting dry eye disease. Tear film breakup time, an impregnated fluorescent strip moistened with normal saline is instilled into lower fornix, and patient is asked to blink several times and observed under cobalt blue filter in slit lamp. Breakup time less than 10 seconds is considered abnormal, and test is repeated 3 times and average is calculated. Shimmer's test, it measures the amount of wetting of Wortmann 41 film paper. According to the wetting of the shimmer strip, dry eye was graded as normal when the reading is more than 15 mm. Mild dry eye is 11 to 15 mm, moderate dry eye is 5 to 10 mm, severe dry eye is less than 5 mm. OSDI questionnaire overall score were calculated and categorized into 3 groups. Normal score 0 to 12, mild symptoms 13 to 22, moderate symptoms 23 to 32, severe symptoms 33 to 100. The data was collected by self-administered method. Data analysis, the collected data was entered in Microsoft Excel 2010 and analyzed using SPSS 20.0 version. The results were presented in the form of tables. Descriptive statistics were used to summarize the demographic data, and Fisher's exact test used for comparison between categorable variables. The mean age of the study participants were 21.88. In a OSDI questionnaire, 52% of the study sample is normal, 17% has mild symptoms, 16% moderate and 15% have severe symptoms. Shimmer's test, 60% of the sample has normal, 29% mild and 11% moderate. T-BERT, 58% of the sample has normal and 42% has abnormal. In association with average screen time, dry eye parameters, OHDA, Shimmer's test and T-BERT has significant statistical association as p-value is less than 0.01. Discussion. In this study, there is significant statistical association in dry eye parameters with average screen time in medical students. UH3 et al. Study concluded that drastic increase in usage of digital devices after the initiation of COVID-19 lockdown, and there is increase in prevalence of dry eye disease among medical students. Lograj et al. Stated that prevalence of dry eye disease is more among medical students, and more exposure to screen time has strong association with dry eye disease, which is also similar to our study report. Conclusions. The prevalence of dry eye disease among medical students is rising as a result of increasing screen usage. Awareness about prevention of digital eye strain should be enforced in medical students to bring these adverse effects to a minimum level. These are my references. Thank you.